have them come into your business and vaccinate people in your business. You will get a bigger uptick. What UT is doing, had a message from the president of Miami University. They're kicking back in on the vaccine, and other universities around the state, what they're doing in reaching students who might have gone back home after they got out of school in May, and may have been a while before they get the vaccine. Getting that vaccine now, that's very important. So all these things coming together, we are in a battle, and we got to win. But the way we do it is the mask and to keep vaccinating people in the state of Ohio.
Next question is from on-site at UT, and it's from Melissa Veitch at WTVG in Toledo.
Good afternoon. Good afternoon, Governor. It's good to have you in Northwest Ohio.
Good to be here. Thank you.
Good to see you. You know, we were all excited when you got on television and said when we get down to 50 cases per 100,000, we'd be able to get back to normal. And it seems like we're moving in the wrong direction. Is there going to be maybe some moderation on that, or some middle ground here? What do you have to say to everybody as we move forward?
You know, our ticket to freedom is the vaccine. And our ticket to a good summer is the vaccine. Our ticket to a good spring is the vaccine. It's our ticket out. It's our ticket out of what we are in now. And that really is where we have to concentrate on now. You know, I've been asked, do you still think, Mike, you know, this virus is coming up and we've got the variant now, and do you really think we're going to have a good summer? And the answer is yes, I do think we're going to have a good summer. We just have to continue to execute. And the execution is wearing the mask, but we got to keep pushing the vaccine out. You know, the first third of our population has now been vaccinated. Now we've got, and we're doing well with people over 65. And if you look at those numbers every single day, as I do, you know, they're starting to fill in with the younger population. We just have to keep going. So we know how to get out of this. You know, this is not 5 months ago, 4 months ago. We know how to get out of this, and we have the tool to get out of it. We just have to use the tool, and we got to use it every day, and that is vaccinate people.
Next question is online from Chelsea Sick at WKEF in Dayton.
Hi there, Governor DeWine. I talked to the Ohio Restaurant Association today, who said there is a shortage of people returning to service industry jobs. I talked to several restaurants who say business is picking up, which they're thankful for, but they're short-staffed and people aren't applying. What do you think is causing this? One business owner I talked to worries it's the amount of people on unemployment.
Well, I know what some restaurant owners have told me as I've talked to them. You know, they've told me that, you know, some of the things that the federal government has done in regard to unemployment benefits or other benefits may have impacted that. I'm not in the industry, so I'm not the person to ask really about that. But I think what you're seeing is good. And what you're seeing is good in the sense that people are in fact going back to restaurants. You know, 1/3 of us now have that ticket, that freedom, and people are exercising that. You know, they're going to restaurants, they're sitting down, they're meeting friends who've also been vaccinated, and this is all a very, very positive thing. But as far as you know exactly, you know what's going on with restaurants, you're much better off interviewing 4 or 5 restaurant owners than me. So I'm getting it secondhand. I see our mayor out here. Wade, how are you? Come up. Come up and say hi. Come on. Stand up here. Come on. I just spotted you out there. I'm sorry.
Standing at the wrong podium.
You're good.
We're doing well. I got my second shot yesterday, so my arm is a little sore, but other than that, we're doing well. I came here especially because I was hoping the First Lady would bring her chocolate Buckeyes, and I see that she did, so we're in good shape. In all seriousness, next week, we're making, no, it was,
You gotta have one.
all right, no, well, no, all right. Well, next week we are making a few of our fire trucks and ambulances available to the V Project and the Health Department and use them as sort of mobile, I don't know how to describe it, not mobile vaccination sites, because we're starting to go door to door. I think Wednesday is the date we have in mind. We're going to start going door to door. And if we encounter someone who wants the vaccine, but, you know, is having a hard time getting it, we'll be able to say, well, in that ambulance right behind you, you know, you can go get one right now. So we're trying to do our part working with all these wonderful partners. Thank you for the Buckeye.
Governor,
Thanks so much. The mayor and I talk, we didn't talk today. I missed the call today. John was on, Lieutenant Governor was on. But John and I talk to the mayors of our major cities every time we get ready to have a press conference. And so, Wade, thank you for your work. And the community's really come together. It's the county commissioners, you, everybody, elected officials, but it's also nonprofits. It's everybody really making a difference. Lieutenant Governor.
yeah, you know, one suggestion that we work with all employers on who may have employees who have some hesitancy to return to work is to work with your local health department to get them scheduled for vaccinations so that they can feel protected, so that they can feel that they are ready to go back to work. And so work with their local health providers, work with your local health department to get all those employees vaccinated so they can have the confidence to go back to work and serve your customers.
Great.
Next question is on site at UT, and it's from Tom Troy at the Toledo Blade.
Hey, Tom. Good to see you in person.
Thank you, sir. Nice to see you in Toledo and also Mrs. DeWine.
Thank you.
You just mentioned a minute ago, talking about people getting the vaccine. We're doing well with people over 65. What's the problem with the people under 65? What are we seeing in common? What is the common denominator for people that are hesitant or unwilling to get the vaccine?
Well, one difference is the older you are, the longer you've had to get this shot, because we opened at 80 and then went to 75, 70, 65 and down. You know, I think that the data is pretty clear that the likelihood of death goes up the older you are. And that's why we, you know, first targeted people who were over 80 and then down. That's why we targeted people who were in nursing homes. But the reality is that anybody can get it. We just heard about someone who was 40-some years old and got it and has died from it. So, you know, it's not benign for you, no matter what your age is. And there's a potential of dying. I have on my desk a card the family sent me of a young person who I think was 20, University of Dayton student. So it can strike and have horrible, horrible consequences for anybody's age. I think if young people look at this as, this is your ticket to freedom. This is your ticket to go visit your grandmother. It's your ticket to travel. It's your ticket to do all kinds of things. And if we look at it that way, I think we have a great shot at getting enough people vaccinated of all ages. So it's a process. I look at this as a process. It's like a lot of things in life. You know, the first third of it is easier. You know, the first third people we vaccinated in this state were people who really, really wanted it, had made up their mind they wanted it. Now we're into the next third. And the next third are people, you know, it's not that people necessarily are against doing it. They just haven't got around to it in some cases. And Fran, I've learned a lot. I mean, when we go out and just literally talk to people who are getting vaccinated and they tell us, you know, I always ask, did you have a hesitancy? And you know, you're getting vaccinated now. I might see somebody who's older and they're just now getting vaccinated. And the question would be why? And many times the answer comes back, well, I just kind of wanted to see how it's going to work out. I didn't want to be the first to do it. So I think it's a process. Our experience is that the most trusted person is their medical doctor, their personal doctor. But we're also seeing people really influenced by their own family members and by their own friends. And so we just encourage everyone who's got the shot go out, talk to your friends, talk to your neighbors. But I think really what, Tom, what is going to drive this is a ticket to freedom. This vaccine is a ticket to freedom.
Next question online is from Alexis Moberger at WSYX in Columbus.
Hi, Governor. Now that Franklin County has gone to a purple level, will we see any more restrictions, a possible curfew, anything to follow?
We certainly do not intend to do anything in regard to the schools or anything else. What I think people should look at is the case numbers. And while Franklin County is certainly not low, it's not the highest. I think people should look at those case numbers. And, what we're seeing in Franklin County is we're seeing in many, many, many other counties in Ohio. And that is a strong variant, a variant that is multiplying very quickly, a variant that is more contagious than what we have seen in the past. So we have this dichotomy, really, of a lot of people in Franklin County are now vaccinated. A lot of people aren't going to spread it. A lot of people aren't going to get it. We're making it harder and harder for this variant to multiply, but at the same time, it's so powerful that it is multiplying. So we know what we have to do in Franklin County. We know what we have to do across the state, whether it's Lucas County or Wood County, wherever it is. And that's, we got to keep getting vaccinated, and we got to do it at a fast rate. And so, God bless all the healthcare workers and all the volunteers and all the people who are literally taking this vaccine to people. This is precious. It saves lives, and it's how we get out of this.
Governor, if I could add one thing to that, I know when I looked at the numbers this morning, I saw Franklin County had gone purple. It made me grateful that we made the decision way back when to vaccinate all the teachers and the school personnel, because we protected them, and now there doesn't need to be a change of strategy there, because those the people that work there are protected, and it can be managed because of that.
Yeah, and I would just say, if you have a child who's 16 or over, time to get the child vaccinated. It's really time to do it. We're trying to make it available in schools in some places, but there's slots out there, and all you have to do is find the Pfizer. If you find somebody that's got the Pfizer, and there's a lot of Pfizer out there, and there are a lot of openings of places that have Pfizer, get your son, get your daughter in, get them vaccinated. John and I talked the other day to athletic directors as well as superintendents. And, for an athlete who wants to have a season, whether it's a spring season of track and track and field, or it's baseball or whatever it is, or fall season, this is the way to have that full season.
Next question is on site at UT from Jeff Smith at WTOL in Toledo.
Hey, Jeff.
Sorry about the long walk around, Governor. Welcome. Thank you so
Thank you.
much for being here today and taking our questions. I wanted to kind of make this personal, but also address a little bit back to what Melissa was asking about the 50 per 100,000. I've got a daughter who's got an autoimmune deficiency. And when we go to the hospital, we continually look for hope, right? And when we get some, we mark it on the calendar. We say, that's the day. That's when we're going to get out of this. We're going to have a little bit better fight against this. Do you regret putting that number out there that some have called unattainable? Because 50 per 100,000, since you mentioned that at the beginning of March, just seems unreachable.
It didn't seem unreachable, though, when it was going down every day. And we were looking at that and trying to, if you remember, we were all trying to project, hey, if we stay at this rate, we're going to be able to knock this down. But I'm going to let Dr. Vanderhoff answer the question, because the question is, that's unattainable? And I will say, no, it's not unattainable, certainly. And it's not unattainable because we have the shots, we have the vaccine. And at some point, that weight of that vaccinations will overtake this virus that is moving upward. When that is, I can't tell you. Dr. Vanderhoff.
Governor, I think you answered it very, very well. And as we're thinking about, all right, what might be that beacon of hope? What might be that thing that we can focus on as an indication that we're getting there? I think the governor also pointed in that direction, and it's vaccination. Vaccination, as he said, is our path out. It is our ticket to freedom from this pandemic and this virus. So as we watch those vaccination numbers rise, and now today we see first vaccinations, and it looked to me like 35, 36% of arms. That's very encouraging. That's very impressive. And we know from looking at other parts of the world who have contended with this variant that as their vaccination levels rose, even the variant was put at bay. And so you can look at places right now like Israel, which is surrounded by high concentrations of variant, and yet in that country with very high vaccination rates, it's pretty much business as usual. They've gone back to pre-pandemic behaviors and are having no trouble. If you look at the UK, which was frankly devastated by the B117 variant, they're finding themselves now being able to lift a lot of restrictions, get back to normal, and it's all because of vaccination.
We have hope, and the hope is the vaccine. Imagine if we did not have the vaccine, what would we be saying today? And anybody would say, well, what's the hope? And we would have to, I don't know what our answer would be, but we have hope, and the hope is the vaccine. And it's a very, very effective vaccine. It works. We just got to keep punching away at this.
Next question online is from Joe Ingles at Ohio Public Radio and Television.
Hello, Governor.
Hey, Joe.
Hi, I wanted to ask you, today in the Wall Street Journal, there was a story about people who are getting breakthrough cases of COVID. That meaning that they've had the vaccine and yet they still get COVID that even requires hospitalization. Is Ohio tracking breakthrough cases of COVID? If you aren't, why not? If you are, do you think that that will lead people to believe that they should get the vaccine? What do you expect to come of that?
Well, let me give you what the numbers are. There have been 154 reports of fully vaccinated individuals, those 2 weeks from their final dose of vaccine, later getting COVID-19. So we have 154 cases that we are aware of. In these cases, of this 154, there have been 14 hospitalizations, and there have been zero deaths. The age range of that group has been from 19 to 98. The median age has been 62. Dr. Vanderhoff, you have anything to add to that?
Yes, Governor. So if we look at those numbers, they should be incredibly encouraging to us. 154 is less than 1%. We, from the beginning, were thrilled because these vaccines appeared to be about 95% effective. Well, they're proving to be more effective than that in the real world. Remembering that no vaccine is ever going to be 100% effective for a whole variety of reasons. And as we look at these cases, they fall into a time frame very often where, it could be a simple matter of, we recognize it takes 4 to 6 weeks from the first vaccine until a person is fully protected. So you wrap this all up, and as a vaccine recipient or as someone who is thinking about getting the vaccine, I think you have to look at this and say, these vaccines are just impressive.
Next question on site at UT is from Brian Steinmetz at WNWO in Toledo.
Hey, Brian.
Governor DeWine, Mr. DeWine, thank you for being here. It's a pleasure. With the existing hesitancy to get the vaccine and the growing concerns with the Johnson & Johnson vaccine, how concerned are you that will add to the hesitancy in the area? I know it's across the state.
Well, that's a good question. And I don't think we know for sure. Certainly the stories connected with Johnson & Johnson and what the federal government has done has not helped people's confidence. But I think, as Dr. Vanderhoff says, this is a very transparent process. It should give people confidence that there is a process in place. And only based upon what I'm reading, same thing everybody is reading, you're talking about less than 1 case per million vaccinations. And I'm not the doctor, or the statistician, but if you look at some of the articles that have been written, and some of the experts have talked about risk, and there's a lot of things that we do that are a lot higher risk than 1 in 1 million. So I'm not making light of it. I think they're going through the process. They need to go through and do what the experts do. But I think in the end, people will have confidence in the system, and we'll move forward. We are still seeing a lot of people vaccinated yesterday. It wasn't with Johnson & Johnson, but it was the 2 others. And I think that people, when they weigh whatever small risk there might be connected with the vaccine, it pales in comparison to trying to do battle with a virus that has been morphed into something that is much more contagious than even was before. So, it is dangerous out there. And getting the vaccine is really the way that we get our freedom. And I think in the end, that will weigh heavily on people. Ohioans are pragmatic and they're rational. And they try to weigh things out. And I think when they weigh things out, it's going to be clear. It's already been clear to over, a third of us that they should be vaccinated.
Next question is from Laura Hancock at cleveland.com.
Hello.
On Tuesday,
Hey.
one of the medical experts said that the vaccine demand among people who are younger, like age 40 below, is decreasing compared to older Ohioans. If that's the case and you have no plans to create a vaccine passport, how are we ever going to get over this? What actions can the state take if a significant portion doesn't want it?
Well, I'll go back to what I said a moment ago, maybe explain it a little bit more, but people are rational people. And people are making decisions every day about getting vaccines. Fran and I just met as we walked around and we talked to students, late teens, early 20s, who are getting vaccinated today. They didn't have to get vaccinated today. They're getting vaccinated today. And when you talk to them, they will explain why. And there's a rational basis for why, they are getting vaccinated. They want to see their grandmother. They want to do this. They want to travel. They want to go to a restaurant. They want to go to a bar. They want to feel confident. They want to have that confidence level. And so that's what's happening. And people are making choices, rational choices. And they're trying to say, okay, if I get this, compare whatever the risk is versus what the risk is of not being vaccinated and not being covered and going out into the public. And I think that, again, we are still seeing people die. We are still seeing people get very sick. We're seeing young people get sick. So, these are rational decisions that people are making. In our nursing homes, we are saying to people who work in the nursing homes, if you're vaccinated, it will be at one level of testing. If you're not vaccinated, it will be a more stringent level of testing. We are seeing employers who are making, decisions. So, I just think all the different things that are out there that people make their decisions, it's not always about the government. In fact, usually it's not about the government and shouldn't be about the government. It's about what are their odds and where do they feel confident? And I think not only is this ticket to freedom, it's a ticket to giving you confidence. It's a ticket to having you not worry all the time that you're going to come down with the virus. I think that's powerful.
Next question online is from Nathan Hart at WCPO in Cincinnati.
Hi, Governor. Since the state of Ohio brought in subject matter experts from the private sector a little while ago to help fix the unemployment system, what progress has been made?
I don't have the director on here. I'm happy to bring the director in next time. He was giving me a briefing today. He testified today in the state legislature. So I'm going to pass to the man who's dealing with that every single day. I mean, certain big thing that was done is basically the door was closed, to dramatically slow down the amount of hacking that was going on, to slow down the amount of fraud that was going on. And that certainly is one thing. I get updates from this group. These are people primarily from the private sector who we brought in, and they're doing a very good job. We made a contract, Google, in regard to how you sort out data, and basically the way they explained it to this layperson, non-tech person, is that you can go through and you can figure out very quickly with big data what cases are likely to have fraud in them and which are not. And then you take the ones that are not most likely, and then you try to process them and get that money out to the residents of Ohio who are just the victims of the fact that there's other people that are trying to scam the system, people who live all over the world that are trying to scam the system. So those are certainly some of the things that have been done, but the Director Dan Schroeder, our acting director, certainly can give you a much fuller account of that.
Next question online is from Alex Ebert at Bloomberg.
Thanks for holding this, Governor. You had previously stated that the J&J vaccine was going to be used to help vaccinate students at universities across the state. How has the pause here impacted what the state is having to do in terms of reaching out to the students when they go home over summer break, or shift resources across the state to get young people vaccinated? Thanks.
Yeah, I think good question. I think one of the things, just as an example, that UT is doing, and I know some other schools are doing this too. They're trying to sort out, frankly, their students. Ohio State, I believe, was doing this. Their students who live close versus their students who live a long way away, and trying to, with a 2-shot regimen, trying to get the ones who live far away or further away, get them first shot and then the second shot while they're still on campus. For those who live close, and still try to get that first shot while they're on campus, but maybe a week later, and then they will have to come back to get that second shot. And look, we encourage every student, everybody who gets the first shot to get the second shot. That's the protocol. That's what people should do. We encourage them to do that. We also know for those who, for whatever reason, it doesn't happen, they don't get it done when they should, that first shot is still pretty powerful. So, schools are adjusting. We have adjusted some schools that were, had the J&J. We've been able to move over some Moderna in some cases, or Pfizer in other cases. So there's been a lot of shifting around, in this past week. And then just while I'm thinking of it, we made a significant decision. Every week's a different stage. And so one of the things that we are doing this week, when we tell the federal government where to ship it, we have a lot of primary care physicians who for the first time are going to be getting the vaccine. And what we believe that's going to do, nobody knows their patients better than the primary care physicians. And they're going to be able to reach out directly to their patients. And some patients, may only trust that primary care physician. But when that primary care physician reaches out to them, they may be much more likely to get the vaccine than if they had to go to a mass vaccination site or if they had to go someplace that they're not familiar with going. So we believe going to these primary care physicians at this point, most of them are not receiving a lot because they cannot process a lot in a week. But we're going to monitor that. We're going to see how that works. But we have a lot of primary care physicians. I don't have the number here, but a lot of them will be getting that vaccine this coming week, beginning Sunday, Monday. And we think that is another thing that we can do that will help us penetrate, get more people vaccinated.
Next question online is from Jesse Balmert at the Cincinnati Enquirer.
Hi, Jesse.
Hello, Governor. Thanks for the time. My question is, since more Ohioans are getting the vaccine and we know the vaccine is effective against the variants, and you had the number about a high percentage of mask compliance, where do we think this spread is happening? Why are the numbers going in the wrong direction?
We'll let Dr. Vanderhoff take that. Doctor?
I think this is a very clear indication that these variants, which all of the research and literature has told us are more contagious, are in fact more contagious. And the governor described it pretty well in an earlier set of comments today. When you take a virus that is more contagious and put it into a population, even though you may be doing a good job with things like masking and distancing, the vaccination, the immunity of that population becomes ever more important. Candidly, I and many other physicians and people in the medical field are absolutely confident that were it not for the levels of vaccination that we enjoy today, the variants at the levels we're seeing them across the country, I think would be wreaking absolute havoc. What they are telling us is, and I've said this before, this virus is not going to go away easily. To get it behind us, we have got to get our collective immunity up to where it needs to go. One more thing I'd add is that as we think about the younger populations, while it is certainly true that this virus continues to be more of a threat as we get older, it is not benign. We shared at a previous press conference the cases of MIS-C, the multi-inflammatory syndrome in children. Now, those numbers are not high numbers, but for the kids who are impacted, it's devastating. We've got the long haulers, and we have instances of people with persistent symptoms of all ages infected by this virus. So vaccine, vaccine, vaccine.
Thank you, Doctor.
Next question online is from Josh Rutenberg at Spectrum News.
Hey, Governor.
Hi, Josh.
It's a two-part question for you. First, certain people have asked about the 50 cases per 100,000 metric, but just wanted to get definitively, you're not going to move off of that metric, are you?
Look, we're going to follow what experts tell us in medicine. And look, we are this close to victory. Now, I don't know how many weeks it is, but 35% of the population vaccinated. Every day we're vaccinating more Ohioans. That's how we get out of this. So no, I'm not going to change that number, but I truly believe that, we are going to be able to crowd this virus out. Maybe not totally out, but crowd it down. And, it's like, I guess I would make the analogy to fire. If it doesn't have fuel, it's not going to spread. And so we've already eliminated 35% of the people who can't be hosts for it, can't spread it. And so you just continue to eliminate more and more people. I truly believe at some point that weight of those numbers of people who have been vaccinated will overcome this raging virus.
The second question. is I've had some in the community come up to me and ask, when you implemented the curfew, the beginning and end of it was tied to rising hospitalization numbers and hoping that they would go down, but it seems like the mask mandate and other restrictions are tied to this case rate. Why are these restrictions not tied to hospitalizations like the curfew versus the masks or versus the cases?
Well, first of all, we're not even close to where we were, the number we set in regard to the curfew, if I understood the question. Not even close to that. I mean, look, we use the tools that we have, and we've learned a lot throughout this. And one of the things that we've learned is the power of the mask. We're all sick of masks. I get it. You know, even this beautiful one that says UT on it. You know, people are tired of wearing them. But we know they work, and they know they will protect us. And so what we've tried to do with the knowledge that we've achieved over the last year, collectively, the medical community, health people, we've tried to say, okay, what do we do now? People have been doing this for a year. They're tired. And so what we basically said is, we think you can do about whatever you want to do. You just got to be careful and wear a mask. And if you do that, and at the same time, now that we have the vaccine, the power of the vaccine, the power of this vaccine it's our ticket out. It's going to get us there. It's going to get us home. And so it's a different situation today. We now have that vaccine, and we know the power of the mask. And so we're going to concentrate on those two things that make the biggest difference.
Next question online is from Kevin Landers at WBNS in Columbus.
Hello, Governor.
Hey, Kevin.
What can the state do to make the vaccine more accessible, if that is our ticket out? And what assurances do you have from Pfizer and Moderna about how much more the state will need to meet the demand?
Well, we're getting in this week, coming week, over 400,000 doses. It's not as many as we got because you're taking out the Johnson & Johnson, and you're taking out from the federal pharmacies, and you're also taking it out from what we were getting. So, but in spite of that, we're still getting over 400,000 doses. And in regard to what else the state can do, we're very open to ideas and suggestions. But the most powerful thing in this fight is what local communities are doing. We're empowering them to do it, but they're the ones who are doing it. So like the mayor talked about, it's like the doctor talked about, you know, going out into that community. How do we reach more people? Every day, people in the community thinking, okay, how do we reach people who for whatever reason have not gotten it, have not been able to get it, haven't had the inclination. And, you know, you're seeing us, you know, Kevin, evolve. You know, it was one thing when we had a small amount of vaccine, a lot of demand, goal to get out just as quickly as we can. We've gone to, you know, a lot of sites. We always had a lot of sites. We started with 700 or some sites. Now we're up to 1,500 sites. But the action is in the community. And when a health department or somebody is telling us, hey, if we had more vaccine, we can reach a Hispanic population over here. We can reach this population here. We can reach that population here. We can go into schools. You know, we're giving them the vaccine, and we're working very closely with them. So we're listeners because they know their community better. They know how to get it out to the people in their community.
Next question online is from Sarah Arthurs at the Findlay Courier.
Yes, thank you for doing this, Governor. Someone else had asked this question, I think, a week ago, and I'd just like an update. Are you regularly in contact with Governor Whitmer, and how closely are the states of Ohio and Michigan kind of working together to talk about the variant?
I talked to the governor yesterday. You know, we don't talk every day. Sometimes not every week, but we certainly stay in contact. I stay in contact with, you know, the other governors surround us. Yeah. So we stay in touch, and it's you know, it's as you can imagine, a conversation of what are you doing, and we share ideas. We share ideas of what, you know, one state is doing, and you know, we don't I don't pretend to have all the ideas, and I'm always anxious to hear what other governors are doing.
Next question online is from Dan DeRose at WOIO in Cleveland.
Hey, Dan.
We'll go back to Dan. Next question is from Dustin Ensinger at Gongwer News Service.
Hi, Governor. I was wondering if you have any thoughts on the efforts in the General Assembly to move Ohio in the direction of partisan judicial elections, but only for Supreme Court and appellate court races.
Yeah, it seems like to me a logical idea. I haven't totally studied it, but it seems to me like a logical idea.
Next question is back to Dan DeRose from WOIO in Cleveland.
Sorry about that, Governor. How are you today?
I'm well, sir.
And we're keeping our eye on the Wolstein Center up here and the Johnson & Johnson situation. Is it your understanding when you heard from the White House yesterday and they told you this pause would be days, maybe weeks, is there still a hope that for April 27th that the Johnson & Johnson will be at the Wolstein Center, or are you starting to work on a plan B?
Well, we're frankly working on a plan B and a C and a D. And I don't have anything to announce today, but we'll be back when we know something. But yeah, we're looking at the different alternatives, looking to see what we can do. If that, what they announced yesterday puts us on a time frame, but the federal government wants to know before that time frame is over which way we want to go. So we're kind of trying to balance that.
Next question is from Luis Gill at Ohio Latino Television.
Luis.
Hello, Governor. Can you hear me?
I can hear you well. Thank you.
Thank you, Governor. I had a question for for the Lieutenant Governor, but I guess he's missing. Is the First Lady available for a question?
I don't know whether he's still with us. Is he? Lieutenant Governor is, so go right ahead. No. I'm available for a question. Lieutenant Governor is not. So.
Is the First Lady available for a question?
Oh, I'm sorry. I didn't hear. Yes. Are you available?
Hello, Mrs. DeWine.
Hello.
My question is, if you have a front seat on this incredible moments that Ohio is living, what are your words of wisdom for your husband as he comes home and he needs a place to rest and recharge? What did you say to him when he comes, and what do you say to him in the morning as he leaves to recharge and go confront all this virus that's happening and is leading Ohio into places that unknown places?
Well, it has been a crazy year. He hasn't left home that much in the past year because we've been together. And so I think, every day we talk together. I get to listen in on a lot of his phone calls with him. And we just talk about things, and I give my ideas, he gives his, and we try to do things. We try to, take walks and see our family and things like that. He has his special dog, Dolly, who keeps him very good company during this time. But I think just being home and having our family around and being able to go outdoors now that it's spring has been really good. And, this is our 34th vaccine site that we've been to. And so going out to each of those sites has also been so important, because he's, like today, he asks every student that he talks to, what did you think about this? How do you feel? And he learns things from all different people. The doctor that spoke to us earlier, when she started telling him what she was doing out in the community, these mobile clinics in parking lots, he said, will you please come on and share with everyone what you're doing? So I think, we're just sort of in this together, and we're working hard, and, being out here, seeing what everyone's doing is really helping us help everybody else. Thank you.
Governor, next question is the last question for today, and it belongs to Sean Cudahy of WHIO in Dayton.
Hi, Sean.
Hi, Governor. I guess finishing a little bit big picture here. You've talked about, the vaccine, then wanting to really get people vaccinated quickly, looking at the numbers with COVID right now. So much is open compared to a few months ago, but do you have a projection, just looking at all the different numbers that you have available, on when you think things are going to really start to look even more normal, closer to pre-pandemic level? Is that something that you're assessing?
I wish I had a crystal ball. I wish I knew. I've asked epidemiologists, I've asked experts, and no one can pinpoint a day. So I'm not going to be, arrogant enough to think that I can pinpoint a day. But we get closer to that day every day when we're vaccinating thousands and thousands of Ohioans. And those days where I look down, it's 50,000 or 60,000 I saw were vaccinated the day before, or 70 or 80,000. Those are very good days, because I know we're getting close to being done with this. I know we're getting close to freedom. I know we're getting close to, being able to move on with our lives. So, we've done well in Ohio so far. We've done well in spite of this variant that is spreading, but we just have to stay focused every single day and continue to find different ways to reach people, to be able to vaccinate them. So I'm optimistic, but I can't tell you, when that day is going to come when we, vaccinate enough people to have the job done. So I want to thank everyone. It's been great to be here in Toledo. To close, we want to take a moment to recognize Minority Health Month. Minority Health Month was originally created 1915 by Booker T. Washington, formalized in 2002 by the United States Congress. Today, we know that health disparities in minority communities certainly persist. This year, the National Minority Health Month theme is Vaccine Ready, in recognition of the disproportionate impact of the COVID pandemic on minority communities. Our team reached out to minority healthcare providers from around the state of Ohio to create this 30-second PSA, which we're now going to play.
I think that's part of the hesitancy of taking the vaccine, is that people think that it was just developed so quickly without any knowledge.
We cut through the red tape
and cut a lot of the risk-taking that relates to vaccine development out.
So anything that we can do to reduce the severity of your symptoms and to prevent death, we should do it as quickly as possible. And all of these vaccines will do that.
The vaccines are safe,
tested,
and effective.
For more information, go to coronavirus.ohio.gov.
Well, we want to thank everyone, and again, thanks to the University of Toledo, and we look forward to seeing everyone next week. Thank you very much.